So just about every baby is born with the potential for a healthy life. And our goal in ECHO is to maximize the potential for every baby to grow up healthy. And we aim to do that by creating the nation's premier program in research in child health.
I do see what you are doing as another exceptional opportunity in cohort research, unlike anything that's really been done before, with opportunities to provide the critical information that we currently lack to try to understand how it is that children get off on the right foot.
So we have 7 components in ECHO. We have coordinating centers and data centers. Then we have 2 components that involve the moms and the kids. One's the Idea States Pediatric Clinical Trials Network, which aims to have kids who are in underserved areas or rural areas participate in clinical trials. And the other is the ECHO Cohorts, where we're bringing together observational studies from many states, from many investigators, to look at the early origins, the early environmental origins of a number of high-impact child health outcomes. We're really happy to bring together the principal investigators, 110 of them, from all of the components of ECHO together in one place to really create new and innovative ways to look at how we can improve child health. And one of these ways is by knitting together a number of cohorts so that we can do things that you can't do with cohorts alone. We have bigger numbers, we have diversity, we have geographic, racial, ethnic, socioeconomic diversity, which really helps in answering questions that we haven't been able to answer before. Engagement of stakeholders is one of the key goals of the ECHO program. And the stakeholders are at different levels. We have stakeholders at the congressional level, at NIH level, the participants themselves, mothers and children. And at this meeting, we're focusing on engaging our investigators. It's so important to engage investigators in team science, because without that, the whole cannot be more than the sum of its parts.
We are intensely proud of the way in which this has gone forward. And may I say, I'm intensely delighted that Dr. Matt Gillman agreed to take the offer to come and lead this enterprise based upon all of his extensive experience with cohort studies, his training as a pediatrician. We are very fortunate indeed to have a leader of his skill and stature to lead this forward.
Success would look like a couple things. One is, in our processes, we want to leave behind lessons learned and best practices for how to do team science in the 21st century. Part of that is coming up with policies for data sharing, for biospecimens, for publications that everyone buys into. And the second is the scientific part. We're looking to address solution-oriented questions in our observational studies and high-impact clinical trials that really have an impact on policies, programs, and practices that improve the health of children in the United States.